What happens if you don't treat repetitive strain injury? Hello, I'm Deborah Quilter. I've written 2 books on repetitive strain injury, and we're going to talk about the consequences of what happens if you don't treat repetitive strain injury. Repetitive strain injury is an umbrella term, and it refers to many ailments of the upper extremity, including the neck, the shoulder, the upper arm, the elbow, the forearm, the wrist, the thumb, and the fingers. The only cure for repetitive strain injury is prevention. A lot of people ignore early warning signs of RSI. It's not really their fault because they may just dismiss these weird feelings in their hands, or constantly dropping things, or feeling like they're losing grip strength, or having trouble buttoning buttons, or driving, or lifting things. They may dismiss those signs as nothing important. And the signs of repetitive strain injury usually come and go in the beginning of the injury, when it's your chance to turn things around. That's when you're in stage 1. Let's talk about what can happen if you don't treat repetitive strain injury. And I'd like to add here that the first thing you need to know is that repetitive strain injury doesn't go away on its own. You need treatment. You need to stop the offending activity, get into treatment with a good manual therapist, and also learn rehabilitation exercises so that you can strengthen weak muscles and lengthen muscles that are too tight. You also need postural retraining so that you're sure you're really sitting up straight whenever you're at the computer or at the activity that you're doing that's giving you the problem. And it's not enough just to change you. You also need to change your workplace environment. Maybe your chair is too high. Maybe your monitor's too low. Maybe your arms are at an awkward angle. All of these things need to be addressed and corrected so that the manual therapy that you're getting is not being counteracted by going back to the same workstation or activity that got you into trouble in the first place. Repetitive activity is inherently risky, especially with new devices such as computer keyboards, mice, and cell phones. And I'd also like to say that physical therapy, improving your posture, improving your workspace, making your workspace more ergonomic, taking frequent, regular breaks from the offending activity cannot overcome the sheer overuse that you're subjecting your hands to on a daily basis. The co-author of my first book used to say that you were in the danger zone of getting repetitive strain injury with as little as 2 hours of computer use a day. That's hardly any time at all. And that was before everybody had a cell phone, which brings with it a whole different set of risk factors for RSI. The other thing that can happen if you don't treat repetitive strain injury is you can get substitution or compensatory injuries as a result of using yourself differently. I'll give you an example. A lot of people injure their dominant hand using the mouse. So they figure, well, I'll just switch to my non-dominant hand and use the mouse that way. But then they injure the non-dominant hand. So this is an example of what can happen because you're using your body differently. It's very awkward, and you're probably in the wrong position to begin with. Many people with RSI start out with just one diagnosis, and then they receive many more diagnoses because of the way they use themselves differently to compensate for their original diagnosis. So if you don't change all of the risk factors, even the best treatments, such as really great physical therapy, won't be enough to turn things around. While people are having these symptoms, very often they continue to work because that's their job. They have bills to pay. Or they could be taking something like a non-steroidal anti-inflammatory, which they may have received from their doctor, but that masks the pain while allowing the injury to become worse. Non-steroidal anti-inflammatories can also have very serious side effects. Some people use splints at work thinking that that will help, and that can make things considerably worse and lead to even deeper repetitive strain injuries. People might seek out something like massage therapy, and maybe they'll feel okay when they're on the table getting the treatment, but find that it really doesn't help them when they're at their computer or doing the offending activity that got them into trouble in the first place. And then finally, when people are in really serious pain, a lot of times they think, I'm going to take some time off. Maybe it's 2 weeks, maybe it's a month, maybe it's a 6 months. I've heard all kinds of stories like this, and they are often very surprised to find that very soon after they begin working again, the symptoms return. So all that time off did not cure them. Then it becomes really serious because people can either get fired from their jobs because they can't keep up with the previous quota, or they leave their jobs because they just realize they're in so much pain they don't want to do it anymore. This can lead to serious financial problems. You can imagine. You had an income coming in and all of a sudden it stopped. Even if you're on workers' compensation or disability, that amount may not be equivalent to the amount that you were making when you were working. And worse, you can become virtually unemployable because there are vanishingly few jobs that you can do without normal hand use. I've covered that in another video. The other thing to consider is that people with repetitive strain injury have not only lost the functional use of their hands for their occupation, but very often find just daily chores to be difficult or impossible. I'll give you some examples. Things like washing and styling your hair, brushing your teeth, buttoning buttons, chopping vegetables, opening doors, pressing elevator or ATM buttons, driving. You get the idea. Anything that you use your hands for could become problematic. It's not uncommon for people to tell me that they can lift up a coffee mug, but they have to put it right down because they really just can't even lift a coffee mug. Many people with repetitive strain injury live in chronic pain. This can be problematic because it's invisible. You have a hidden disability, and this can make other people think, what's wrong with you? You should be able to do that. That's such a simple thing. It's a hidden disability, and it could lead other people to think that you're malingering or faking it because it's such a simple activity to just lift a coffee mug to your lips. What could be so difficult about that? They don't understand how painful it could be or just how weak you've become from repetitive strain injury. Sometimes the same people will think that there's a quick or easy solution for repetitive strain injury. And they'll say, well, why don't you get the surgery? But the problem is there isn't surgery for a lot of these conditions. It's a soft tissue injury. In many cases, there is no surgical remedy. There is no treatment that's going to cure repetitive strain injury. So all of these things can lead to another factor that you need to consider if you don't treat repetitive strain injury, and that is psychological. Because how would you feel if you had really serious debilitating problems and people didn't believe you? Or suddenly you lost your social circle because you, say, couldn't go bowling anymore, or couldn't play tennis, or couldn't go biking, or couldn't go running because the bouncing action of running bothered your hands, or couldn't do any number of sports that rely on hand use in order to enjoy them. You can also have good days and bad days with repetitive strain injury. So one day you might be able to do something pain-free, and another day you can't. And that can also lead other people to be skeptical about whether you're really injured or not. People with repetitive strain injury can become depressed to the point where they consider suicide. And if that applies to you, I highly recommend that you get psychological counseling. In fact, it's a good idea to have psychological counseling from an understanding psychotherapist who believes in repetitive strain injury and knows how difficult it can be for you, because it's good to have someone on your side, someone to talk to, because your friends might get tired of hearing about it, and this person is paid to help you get through this time. So I believe psychological counseling can be really useful, but be careful of any psychologist who suggests that this is all in your head. Repetitive strain injury is a real physical injury that can be diagnosed clinically or through imaging. So these are a few of the outcomes that can happen if you don't treat repetitive strain injury. Repetitive strain injury doesn't go away by itself. You need a thorough, competent diagnosis and proper physical therapy. If you do go back to work, you will need to change everything about how you're working, from your workstation to your pacing to your posture, to the amount of work that you can produce on any given day without relapsing. Now, if you are working, you need to consider the amount of work that you are going to be asked to do, because some jobs will have a quota. And in this case, I really recommend that you become entrepreneurial and work for yourself, because it's really important to keep working. We like to contribute to society. Work is good for the soul. So I recommend in that case you work for yourself, and that way you can set up your workstation exactly the way it needs to be. You can take breaks whenever you need them. You can take the day off or do something else productive if your symptoms are bothering you. So you can really take care of yourself and maintain your hand function without going backwards in recovery. I would also like to really emphasize that it's not fair to put the burden of RSI on the people who get it. We are all being forced to use tools that are highly risky, such as computer keyboards, computer mice, and mobile phones. These tools are inherently risky, especially given the fact that there isn't a massive educational campaign to warn people about the dangers of the tools that they're using on a daily basis. I have written and posted a campaign to end RSI on change.org. I hope that you will read the document, sign the campaign, and share it with all of your friends so that we can get some legislation in place to protect people from getting RSI. Be sure to watch the video that's coming up next or linked in the description below for more great information about repetitive strain injury.